He called her the sweeper the moment she walked into Oak Creek Memorial, pushing a supply cart with water pitchers and fresh linens while the surgical residents laughed. They didn't know. The woman in the faded scrubs with the limp that caught on the tile floor every seventh step had once kept 47 soldiers alive under direct fire in a place called San Jin, where the heat hit like a physical force and mistakes didn't get written up, they got written on flags draped over coffins. They didn't know that the threadbare sneakers she wore to work were chosen because real combat boots sat wrapped in plastic in her car trunk, hidden under emergency blankets, a life she wasn't supposed to acknowledge anymore. She had been wiping bedpans at Oak Creek Memorial in Raleigh for 3 years, moving through the trauma ward with a kind of quiet efficiency that made the younger nurses think she was just tired. Nobody asked her name. Nobody asked why her hands never trembled during codes, even when the monitors screamed. Nobody asked why she moved through the hospital like someone who'd already survived the worst that medicine, and war, could throw at her. Dr. Sterling arrived on a Tuesday in September, his Italian loafers clicking against the linoleum like a metronome counting down someone else's career. His credentials came before him: Columbia Medical School, top of his class, 23 years in trauma surgery, a reputation that hung on the walls like brass plaques. He swept through the nursing station at 6 in the morning, when the night shift was still charting and the day shift was still reaching for coffee, and his eyes landed on Margaret refilling water pitchers at a patient's bedside. His lip curled the way mouths do when they see something they've already decided isn't worth noticing. That evening, he made a $50 bet with 3 surgical residents. The terms were simple: the middle-aged nurse with the limp wouldn't last a week. She'd crack under pressure, quit by Friday, and Sterling would buy the drinks. One resident actually shook his hand on it, thinking it was generous, giving her 8 working days before she folded. Sterling had timed it. He'd seen her kind before. Quiet women who looked fragile in the fluorescent lights always were, underneath. The next morning during trauma rounds, Margaret stood at the medication dispensary preparing doses while Dr. Sterling moved through the unit with his entourage of residents trailing like remoras behind a shark. He was talking about a gunshot wound from the night shift, about how the nursing assessment had been incomplete, about the gaps in documentation that shouldn't happen in a competent facility. His voice was loud enough for the entire floor to hear. At the cafeteria station near the main corridor, Margaret balanced her tray, coffee, toast, a small container of yogurt, and started back toward the break room. She'd worked in trauma for 15 years before the name Margaret Walsh disappeared from every military database, before naval intelligence told her to bury her service record and disappear into civilian life. 3 years at Oak Creek should have been quiet. 3 years of nobody knowing. But Dr. Sterling had other plans. As Margaret passed the medication cart where he was reviewing charts with 4 residents gathered around him, he stepped sideways without looking. His shoulder caught the corner of her tray. The physics were simple: 47 pounds of leverage against a woman carrying hot coffee. The tray clattered to the floor. Coffee spread across the tile like a dark stain. Toast landed butter side down. The yogurt container rolled toward the wall. The sound of it all, the ceramic crash, the liquid splatter, the brief chaos of it, silenced the hallway. 12 pairs of eyes turned to watch what would happen next. Dr. Sterling looked down at the mess, then up at Margaret's face, his expression exactly what he wanted it to be: amused superiority mixed with practiced concern, as if an accident had happened that nobody could have predicted. He didn't apologize. He didn't reach down to help. Instead, he smiled, a smile like a predator showing its teeth, and said, "Pick that up, sweetheart." One of the residents shifted weight nervously. Another looked at their shoes. The fluorescent lights hummed overhead with that particular frequency that made people flinch. Margaret stood very still. Her breath came in one measured count. In, hold, out. The same breath pattern she'd learned in combat medicine training, the same pattern she'd used the night she performed emergency surgery in a forward operating base while artillery shook the walls and a soldier's lung was collapsing at 3,000 meters. She let a single tear escape, just one, and wiped it with the back of her hand without breaking eye contact with Dr. Sterling. Her voice when she spoke was quiet enough that only he and the nearest residents heard it. "I've carried wounded men through minefields heavier than your ego, Doctor. The words landed like ordnance. One resident's breath caught. Another's eyes widened. Sterling's face didn't change, but something flickered behind his eyes, a brief recognition that he'd said something to someone he didn't understand. He recovered in half a second. His expression hardened into something colder. He turned away without responding, directing one of the residents to make a note about the break room incident, and continued his rounds as if Margaret had already stopped existing. She knelt down and began picking up pieces of ceramic, her movements precise and unhurried. The other nurses pretended not to watch but watched anyway. This was the moment they'd remember later, when everything changed, when quiet Margaret Walsh said something that made the unit uncomfortable in a way they couldn't name. She didn't rush. She didn't cry. She didn't retreat to a supply closet to fall apart. She collected the broken pieces, wiped the coffee with paper towels, disposed of the ruined tray, and returned to her station as if the previous 5 minutes existed in a separate timeline. The young trauma nurse who worked the adjacent bed, a woman named Casey, maybe 25 years old with the kind of confidence that only comes from never having failed at anything, came over as Margaret was washing her hands. "That was incredible," Casey whispered. "You're incredible." Margaret didn't respond. She dried her hands on the paper towel dispenser and glanced at Casey with eyes that held too much history to explain. "I'm going on break," she said. It was the driest comment anyone had heard her make, and two nurses who overheard it actually laughed despite themselves, a moment of tension release that made Sterling glance back from across the unit. He didn't smile. He'd already decided that Margaret Walsh had made her first mistake. That evening, Margaret sat in her car in the parking lot for 17 minutes before driving home. The sun was setting over Raleigh, painting the sky in colors that looked like burned scars. Her hands were steady on the steering wheel, which she noticed, her brain cataloging that her nervous system hadn't betrayed her, that muscle memory held. The limp she carried when she walked was from shrapnel taken during a night raid in San Gin, 15 years ago, a fragment lodged in her tibia that the VA doctors said could be removed but would probably cause more problems than it solved. The scar tissue underneath pulled when she climbed stairs. Everything ached in weather changes. But the limp had become useful over 3 years at Oak Creek. It made her seem older, slower, easier to dismiss. The combat boots in her trunk had been wrapped in plastic since the day she arrived in Raleigh, since the day Naval Intelligence handed her a sealed envelope with a new driver's license, a social security number, and instructions: Senior Chief Walsh no longer exists. You are Margaret Walsh, civilian nurse. If you surface, the investigation will destroy everyone involved. Her daughter Emma was doing homework at the kitchen table when Margaret walked through the door of their small house, a 2-bedroom rental with a yard that needed work and neighbors who never asked questions. Emma was 9 years old and had learned not to ask her mother about her day when something felt wrong in the air. Tonight felt wrong. Margaret moved through the kitchen, setting down her work bag, her movements deliberate and careful, the way someone moves when they're holding together. "Hi, Mom," Emma said, still focused on her math worksheet. "How was work?" Margaret set a glass of water on the counter and drank it slowly. "Fine," she said. People were interesting. She sat down next to her daughter and looked at the multiplication problem scattered across the page, 12 times 7, 15 times 8, the basic arithmetic of a life that didn't require what Margaret carried in her muscle memory. She thought about Dr. Sterling's face when she'd said those words about minefields. She thought about the way competent people sometimes couldn't comprehend that someone they'd ranked as incompetent might actually be something else entirely. The next words out of his mouth would change everything. The next morning, Sterling gathered the surgical residents around the nurse's station, his voice carrying across the trauma ward like a tank idling in a garage. "I'll bet anyone here $50 that bedpan Betty over there quits within a week. They always do when they realize real medicine isn't for them." Margaret continued charting vitals 3 stations away, her pen moving steadily across the page without pause, without acknowledgement. She didn't look up. She didn't flinch. That composure was what infuriated him most. During Thursday's morning rounds, Sterling walked past her in the cafeteria. He was carrying his tray, a full one, deliberate and slow, and as he passed Margaret's table, he he bumped it with calculated precision. Her lunch scattered across the floor. Soup spread like a stain. The entire cafeteria went silent. Every eye shifted toward them. Margaret took one measured breath. She watched the broken plate, the rolled silverware, the sandwich sliding across the tile. No trembling hands. No voice crack. She simply set down her own utensil, stood with the mechanical precision of someone who'd done this 1,000 times before, and bent to pick up the debris. Sterling's smirk widened. He called out loud enough for 2 tables to hear, "Pick that up, sweetheart. Make yourself useful while you're down there." Margaret's jaw clenched. Just a flicker. Then she straightened, the scattered pieces in her hands, her eyes meeting his with the kind of cold flat stare that made the younger residents shift in their seats. She said quietly, so only Sterling could hear, "I've carried wounded men through minefields heavier than your ego, Doctor." The cafeteria noise resumed in broken fragments. Sterling's face went crimson. His hands actually trembled, rage or shock, it didn't matter. He'd expected tears or apologies or broken composure. Instead, she'd challenged the entire architecture of what he'd spent 30 years building. That was unacceptable. By Friday, Sterling had escalated. He wasn't yelling anymore. He was thinking. He was planning. During a chart review in front of 4 surgical residents and 2 attending physicians, he threw a patient file at her feet with the kind of theatrical dismissal that had worked on every other junior staff member for decades. The papers scattered. The room held its breath. Margaret bent slowly, her bad knee clicking audibly in the silence, and retrieved each page with methodical precision, her scarred hands moving with the kind of competence that made you wonder where they'd come from. She reorganized the chart. Set it on the desk. Said nothing. Didn't even look at Sterling. The residents exchanged glances. Sterling's jaw worked silently. That afternoon, he'd started documenting policy violations in her permanent file. Charting times off by 3 minutes. Break length exceeding regulations by 60 seconds. Uniform code violations, rolled sleeves, he claimed, violated infection control protocol. The violations were technical and fabricated and absolutely documentable. He made the first call to a hospital board member on Friday evening. Then the second on Saturday morning. Then the third by early afternoon. Each call began the same way, "We have a competence problem in trauma nursing." Each one ended with a name and a file number and a recommendation that someone review her background with particular scrutiny. He didn't raise his voice. He didn't make accusations. He simply stated facts. She had no trauma certification, her references seemed vague, her presence in high-stress situations made residents uncomfortable. He was weaponizing every tool at his disposal with the precision of someone who'd spent decades climbing hierarchy. And Margaret Walsh had somehow dared to suggest she'd carried things heavier than his ego. By Saturday night at 2:02 a.m., the system Sterling had set in motion was already moving. Margaret had been assigned to the overnight trauma rotation, Sterling's influence, ensuring she'd be exhausted for the coming week when the board investigator would arrive. The hospital was quiet in that particular way emergency departments get at that hour, when the violence of the day has burned itself out and the only patients left are the ones nobody expected to need help. Margaret was charting when the paramedics brought him in, and the moment she saw the shallow breathing, the way his left chest wasn't rising, the distended neck veins, she knew. Tension pneumothorax. Collapsed lung. Her hands moved before her mind caught up, 15 years of training that never actually leaves your body, just waits in the muscle tissue for the right moment to wake up. The young trauma nurse assisting her was Danny Chen, fresh-faced and sharp enough to recognize protocol when he saw it. Margaret called for the needle decompression kit with a voice that had gone utterly calm, and Danny moved without questioning. She prepped the second intercostal space, mid-clavicular line, her fingers finding landmarks with the kind of muscle memory that doesn't come from textbooks. The 14-gauge catheter went in at the precise angle. The hiss of air escaping, that specific sound that tells you the procedure worked, that the pressure inside the chest cavity is releasing, filled the trauma bay. The SEAL commander's oxygen saturation climbed. 78, 82. 88, stable. Danny watched her work with the expression of someone who'd suddenly realized they were watching something impossible. Sanjin protocol, Danny whispered, his voice barely audible. He was a combat medic with the 82nd Airborne, 3 deployments, and he recognized that technique the way you recognize your own heartbeat. You're using the Sanjin protocol. That's not in civilian medicine. Who the hell are you? Margaret's jaw tightened. 1 second. 2. The commander's oxygen saturation climbed higher. Just assisting until the attending arrives, she said, her voice level as concrete. But Danny's eyes had moved to her forearms, now visible with her sleeves pushed back in the heat of the procedure. Scars. Not the small surgical marks of someone who'd worked in hospitals. The thick, mottled scarring of someone who'd been in places where medicine was done under fire, where precision meant the difference between a man going home or going home in a box. His expression shifted from confusion to something that looked like dawning recognition, the kind of recognition that made him step back slightly, as if he'd just realized he was standing next to something far bigger than he'd understood. The attending trauma surgeon arrived 7 minutes later and took one look at the setup, the perfectly placed needle, the stabilizing tape, the SEAL commander's climbing vitals, and said only, "Who did this?" Danny was already looking at Margaret. The attending followed his gaze. "Good work," he said, but there was a question in it, unspoken but loud. Margaret stepped back. "I'll monitor from the nurse's station. Call if you need anything." She moved out of the bay with the same measured precision she'd used to perform the procedure, and Danny watched her go, his mind assembling pieces that didn't fit a bedpan carrier at Oak Creek Memorial. That evening, after the SEAL commander had been stabilized and transferred to ICU, Danny found Margaret checking his post-operative vitals. "I was at Sanjin," Danny said quietly. 2010, 2nd Platoon, Charlie Company. "That technique you used, I've only seen 2 people do that procedure. Both of them were." He trailed off, watching her face. "I'm going on break," Margaret said, and she walked away, leaving Danny standing there, holding a chart, understanding dawning in his eyes like a sunrise nobody had asked for. By Monday morning, the hospital investigator had arrived. His name was Richard Hawthorne, and he carried a folder with Margaret's name on it that had been flagged by Sterling personally. The board members had fast-tracked his arrival. Competence reviews took weeks normally. This one had been scheduled for 2 days because Sterling had made the right calls to the right people. Hawthorne was thorough and skeptical and had been doing this job long enough to know that you don't get that many board members interested in a junior nurse unless something was actually wrong. He requested her personnel file. He called her references, all of them vague, all of them evasive when asked about her previous employment. One reference had simply said, "I'm not at liberty to discuss Senior Chief Walsh's service record," and hung up the phone. Another reference line had been disconnected. A third had no record of existing at all. Hawthorne made notes. Sterling watched from his office window, arms crossed, satisfied that the machinery was finally grinding in the right direction. What Sterling didn't know was that the SEAL commander he'd been treating in ICU, the one Margaret had saved with a procedure that shouldn't exist outside classified battlefields, was awake now and asking questions. The nurse checking his bandages said his first request had been for a phone. His second request was for privacy. By Tuesday morning, that phone call had traveled up a chain of command that made most hospital hierarchies look like children's games. The ambulance doors burst open at 2:41 a.m., and the paramedics wheeled in a Navy SEAL commander with a collapsed lung and breathing so shallow it barely fogged the oxygen mask. Respiratory rate of 34, oxygen saturation dropping into the 60s, and a sucking chest wound that the field team had sealed with a chest tube kit. Trauma Bay 3. No attending. Dr. Sterling was somewhere in the hospital, not in the building, not answering his phone. Margaret was pulling a supply cart down the corridor when the charge nurse grabbed her arm. "We need you. Now." The commander lay on the trauma table, chest heaving in short, desperate gasps, his muscular frame rippled with old scar tissue that told a story no medical record would contain. Margaret moved toward him without hesitation. The trauma resident, a nervous third-year named Dr. Chen, was already running through a systems check for access, monitor leads, pulse ox reading numbers that had stopped improving. The ventilator beside the bed looked like it was waiting for permission to save a life that nobody here was qualified to give. "What's his status?" Margaret asked, her voice steady as a surgical laser. "Tension pneumothorax," Chen said, his voice climbing toward panic. "The paramedics decompressed once in the field, but it's reaccumulated. I was trying to reach Dr. Sterling, but he's in a surgery that won't be done for 2 hours. I was about to call." "No time," Margaret said. The commander's oxygen sat at 58 now, dropping. His heart rate climbed past 140. Sweat beaded across his forehead despite the cooling trauma bay. His body was telling the story, pressure building in his chest, his lungs collapsing around his sternum, his heart working against pressure that would kill him in minutes. For minutes. Maybe less. Margaret had done the math in her head before Chen finished his sentence. "Get me a 14-gauge angiocath needle, the longest available." Chen moved. A trauma nurse, younger, uncertain, handed Margaret the needle, and Margaret felt her hand steady as the world around her narrowed to a single focal point. The second intercostal space, midclavicular line. That was the anatomy. That was the protocol. Her fingers found the landmarks on the commander's chest by memory older than her civilian life, by muscle memory that lived in tissue deeper than conscious thought. The needle went in. A hiss of air escaped, the sound of pressure releasing, of a human body's internal physics finally balancing itself out. The oxygen monitor climbed immediately. 62, 68. 74. The commander's breathing eased, his body's autonomic nervous system recognizing that survival was possible again. Margaret secured the catheter with practiced efficiency, her movements a choreography learned in a place that didn't appear on any official map. The trauma nurse who'd handed her the needle, a combat medic from the 82nd Airborne, Margaret realized immediately by the way his hands moved, by the involuntary recognition in his posture, leaned closer and whispered so quietly that only Margaret heard, "You're using the Sanjin protocol." "I was a combat medic with the 82nd. "Who the hell are you?" Margaret didn't answer. She couldn't answer. She'd buried that woman, Senior Chief Petty Officer Margaret Walsh, 15 years ago in a classified operation that went catastrophically wrong. She'd watched naval intelligence erase her decorations, her service record, her name from every database outside a classified vault. She'd been given a civilian identity and explicit instructions: disappear, never surface, never speak of what happened in that valley. If you do, the investigation will destroy everyone involved. She'd become Margaret Walsh the nurse. Margaret Walsh who wiped bedpans. Margaret Walsh who picked up Dr. Sterling's drop charts without breaking eye contact. But muscle memory didn't care about aliases. The commander's oxygen sat at 82 now. His heart rate was dropping toward a sustainable range. His breathing had shifted from desperate gasps to controlled, measured work. Sinus rhythm on the monitor. A human being pulled back from the edge of death by someone whose hands remembered protocols that shouldn't exist in civilian trauma bays. The needle decompression had worked. The pressure in his chest was relieved. His body was remembering how to live. Dr. Sterling walked in at 3:15 a.m. He stopped in the doorway, still in surgical scrubs from a case that wasn't over, confusion flickering across his face at the sight of Margaret Walsh, the bedpan nurse, the woman he'd knocked stray to the floor 3 years ago and watched pick it up without complaint, standing over his patient with the casual authority of someone who'd made life-and-death decisions before Sterling had even applied to medical school. The confusion lasted approximately 1 second. Then his face went crimson. "Who authorized you to perform a surgical procedure?" Sterling's voice was a knife blade wrapped in a doctor's authority. "Step back from my patient. Now." Margaret secured the final piece of tape on the catheter without looking at him. Tension pneumothorax. No attending physician available. This patient had for minutes before cardiac arrest. "I arrested the tension." Her voice didn't climb. It didn't shake. It descended into a register that belonged to someone who'd given orders to men with automatic weapons. He's stable. You're a nurse, Sterling said, and every word was a hammer strike. Get out of my trauma bay. Margaret looked at him for the first time since he'd entered. Her eyes were flat as winter water. The trauma bay is clear. Patient is stable. Your for accesses are established, your O2 is at 82%, and your commander is breathing. She moved past him with the fluid precision of apex predators, her shoulder nearly brushing his coat. I'm going on break. Sterling stood in the trauma bay for approximately 8 seconds, staring at his patient like Margaret had just performed impossible magic. Then his jaw tightened. His hands curled into fists. He reached for his phone. By 3:16 a.m., he'd made the first call, chief of surgery, his medical school roommate who owed him 2 decades of favors. I need you to be aware that we have a credentialed nurse who just performed a surgical procedure without physician authorization. This is a patient safety issue and a liability nightmare. By 4:22 a.m., he'd made the second call to Richard Bancroft, a hospital board member who'd golfed with Sterling's father for 15 years. We may have a serious compliance problem. I want to discuss it before this becomes a legal issue. By 5:15 a.m., he'd called risk management directly. A rogue nurse practicing medicine without supervision. I want an immediate investigation, full credential review, everything. By 6:56 a.m., an outside investigator named Dr. Patricia Vance had arrived at Oak Creek Memorial. She was a credential fraud specialist, the kind of professional who'd spent 2 decades digging through employment gaps and inconsistent references. Sterling personally walked her through Margaret's file, his fingers pointing out the gaps like they were smoking guns. Her previous employment history is sparse. Look at the references from her military service, 3 people who give one-word answers. Look at her initial credentialing from 2021, there's almost no documentation of where she came from before this hospital. That's unusual. Dr. Vance nodded, making notes. Her pen moved across the page with the precision of someone looking for patterns that didn't add up. And Margaret's file didn't add up. Not when you looked at it without knowing the truth. Not when you didn't understand that naval intelligence had deliberately created gaps, intentionally vague references, paperwork designed to be consistent but unhelpful. It was protection. It was also perfectly positioned to look like fraud. By noon, Dr. Vance had called Margaret's listed references. All 3 gave minimal responses. Yes, she'd worked in their facility. Yes, she was competent. No, they weren't available for detailed conversation. The third reference, a retired Navy medical officer whose name didn't exist in any current database, didn't answer at all. By 2:38 p.m., security was at Margaret's locker, a guard she'd smiled at that morning when she'd come in for her shift. He handed her a cardboard box and wouldn't quite meet her eyes. You're being placed on administrative leave pending investigation. Your badge is confiscated pending clearance. Margaret placed her personal items into the box without rushing, her spare scrubs, the photo of her daughter at the community center fair, the pair of worn combat boots she kept in the bottom of her locker, buried under everything else. Tan leather scuffed from 18 years of wear, desert dust embedded in the treads, the laces tied in a knot that she never bothered to untie. She just slipped them on. She never removed them. Those boots had walked through Sanjin Valley in July of 2009 when the operation went catastrophically wrong. Those boots had walked through a minefield and come out the other side carrying wounded men whose names she'd never speak aloud. Those boots had walked toward the helicopter that would carry her away from that valley and into a new life where nobody would ever know what she'd done there. She carried the box past Dr. Sterling's office window. He was standing there, arms crossed, watching her like a man who'd just executed something he'd been planning for months. Their eyes met for exactly 1 second. His expression was triumph. Her expression was exactly the same as it had been 3 years ago when she'd picked up the cafeteria tray from the floor, a slight tilt of the head, acknowledgement of his existence without concession to his authority. The fluorescent lights hummed their mechanical song as she walked out of Oak Creek Memorial at 3:27 p.m., her box of belongings and her legacy of service carrying her toward a parking lot where she'd have to figure out how to explain to her daughter why she'd come home early. Dr. Sterling appeared in the trauma bay at 3:15 a.m. like a shark tasting blood in the water. Margaret was closing the final suture on Commander Price's chest wall, her hand steady as surgical laser beams, when she heard his voice cut through the controlled chaos of monitors and ventilators. "Step away from my patient." Not a request. A command delivered with a kind of venom that only comes from a man watching his authority evaporate in real time. Margaret didn't look up. She tied the final knot with the precision of someone who'd done this under mortar fire, not under fluorescent hospital lights. The suture held. The chest wall sealed. The lung, previously collapsed like a deflated balloon, was now re-expanded and stable. She peeled off her gloves slowly, methodically, and only then did she turn to face him. Sterling's face had gone crimson. Not the red of embarrassment. The red of a man realizing he'd been outmaneuvered by someone he'd spent 3 years trying to break. His jaw clenched so hard she could see the muscles working beneath his skin. "You have no authorization to perform advanced procedures," he said, his voice dropping into a register that made the younger trauma nurse step backward. "You're a bedside nurse. You wipe bedpans." Margaret met his eyes for exactly 2 seconds, long enough for him to understand that she wasn't going to defend herself, long enough for that understanding to terrify him. Then she turned to the monitoring station and began documenting the procedure with clinical precision, vital signs, interventions, outcome. The heart monitor beeped its steady mechanical rhythm, sinus rhythm, strong and true, and that rhythm was the only answer Sterling needed. But he wasn't finished. Not even close. Within 1 hour, Sterling had activated his network like a man pulling the emergency cord on a train headed toward a cliff. 3 board members received calls at 4:17 a.m., 4:23 a.m., and 4:31 a.m. Margaret didn't know the specific words, not yet, but she'd hear them repeated soon enough. A rogue nurse practicing medicine without supervision. Dangerous precedent. Investigation required. The words were carefully chosen to bypass any rational inquiry and go straight to the primal fear of institutional liability. By 5:45 a.m., Sterling had contacted every reference on Margaret's application from 3 years ago, former supervisors, colleagues, a commander from a hospital in San Diego whose name she barely remembered. He didn't ask questions. He issued threats wrapped in bureaucratic language. "I'm conducting a comprehensive review of Ms. Walsh's credentials and employment history. I'd appreciate your candid assessment of her competence and reliability." The implication was clear: speak badly of her or be complicit in covering up her misconduct. The hospital investigator, a thin man with a briefcase and the expression of someone who'd spent 20 years following orders without asking why, arrived at Oak Creek Memorial at 7:11 a.m. with a mandate: review every chart Margaret had touched in 36 months. Every patient encounter. Every medication administration. Every note. Sterling had weaponized the bureaucracy itself, transforming it from a tool of accountability into an instrument of destruction. Margaret worked her shift in a strange suspended state, moving through the hospital like a ghost in scrubs. She could feel the attention now, the way colleagues looked at her when they thought she wasn't watching, the way Dr. Sterling's associates made a point of documenting every interaction with her, the way the charge nurse suddenly began monitoring her work with an intensity that bordered on surveillance. At 3:15 p.m., exactly 12 hours after she'd closed Commander Price's chest wall, security arrived at her station. 2 officers she'd never seen before. One of them held her ID badge like it was evidence in a crime scene. "You're being placed on immediate administrative leave pending the outcome of the investigation," he said, his voice devoid of inflection. "We're going to need your badge, your keys, and access cards." Margaret didn't argue. She'd learned long ago that some fights couldn't be won through resistance, only through witness. She removed her badge, her access cards, her keys. She placed them in the security officer's hands with the same careful precision she'd used to seal Commander Price's collapsed lung. The plastic was cool against her skin. The weight of 3 years of accumulated routine slid away in an instant. From his office window on the 3rd floor, Dr. Sterling watched her walk out of Oak Creek Memorial with the same expression he'd worn when he'd thrown that patient chart at her feet, satisfaction mixed with something that looked almost like fear. She was walking slowly, deliberately, her scrub still bearing the dried blood of a man she'd saved. Sterling had no idea that the blood on her uniform was the blood of someone whose network extended all the way to the Pentagon. Margaret drove home in silence, her hands gripping the steering wheel at 10 and 2 like she was trying to anchor herself to something real. The afternoon sun hammered through the windshield. Traffic moved in the way Raleigh traffic always moved, efficiently, mindlessly, everyone going somewhere they'd already been 1,000 times. She pulled into her driveway at 3:38 p.m. Emma's bicycle lay on its side near the mailbox. Her daughter was at school for another 40 minutes. Margaret had that long to come apart in private. She sat at the kitchen table still wearing her scrubs, the cardboard box of her terminated employment unopened in front of her. The box contained nothing valuable, a coffee mug that said nurse since 2021, 2 pens, a stress ball shaped like a syringe, a half-eaten granola bar. Everything else of consequence had been left behind, her competence, her reputation, her safety. Her hands were shaking as she stood up and walked to the hallway closet, moving aside the folded towels and beach chairs to reach the bottom shelf where she'd hidden the cardboard box 15 years ago. The one she'd never meant to open again. She pulled it down carefully, like it might contain something dangerous, which, in a way, it did. Inside lay a pair of combat boots, salt-stained and sand-scarred, the leather cracked in places where it had bent 10,000 times under weight and pressure. The soles were worn through in the pattern of a specific gait, left heel, right midfoot, characteristic of someone who'd carried casualties through minefields in 120-degree heat. She'd wrapped them in plastic 5 years ago, trying to preserve them, trying to keep the past sealed. The plastic had yellowed with age. She pulled them out and sat back at the kitchen table, still in her scrubs, still wearing the ghost of Commander Price's blood on her uniform. The boots smelled like desert and oil and the specific mustiness of things that had been hidden away. She held them against her chest like they were her own ribcage and someone had just ripped it open. The reminders of her true identity were things she'd learned to live without, no medals on her walls, no photographs, no documentation of the 15 years before she'd become Margaret Walsh, bedside nurse at Oak Creek Memorial. Naval intelligence had made that clear when they'd pulled her from Sanjin. The operation had gone bad in ways that reached all the way to the White House. An authorized mission had crossed an unauthorized border. Authorized weapons had created unauthorized casualties. 3 SEALs were dead because of intelligence failures that nobody wanted investigated. The solution was simple: erase the classified operation by erasing everyone who'd served in it. Bury the decorations, burn the records, and turn a senior chief petty officer into a bedside nurse named Margaret Walsh. 15 years of silence. 15 years of swallowing what she was, of letting men like Dr. Sterling diminish her, of picking up cafeteria trays from the floor without breaking eye contact. She'd done it for her daughter. She'd done it because the alternative meant destroying people who'd served alongside her, people whose families and careers would be shattered by declassification. But saving Commander Price, using the Sanjin protocol while under no supervision, had activated something. A digital footprint. A pattern recognition algorithm somewhere in Virginia. A classified alert that someone had noticed she wasn't dead, wasn't disappeared, wasn't erased after all. The door opened and Emma's voice came from the entryway at 4:45 p.m. "Mom? I'm home early. Miss Rodriguez let us out for the assembly." Then footsteps on the hardwood floor, then the kitchen entrance, then her daughter's small face going white with an instinct that only children possess for detecting adult catastrophe. Emma was 9 years old with her mother's dark eyes and her father's stubborn jaw. She'd never asked about the combat boots in the closet or why her mother sometimes woke up at 3 a.m. covered in sweat. She'd accepted her mother's careful, measured silence the way children accept the sky. "Mommy, why are you home early?" Emma's voice was small and frightened and absolutely certain that something had broken. Margaret looked at her daughter standing in the kitchen doorway, then down at the combat boots in her hands, then back at her daughter's face. The truth sat in her throat like something that had to be swallowed or spit out. She couldn't do either. "Just a hard day, baby," Margaret said, and she pulled Emma close, letting her daughter bury her face in the blood-stained scrubs without explanation. Just a hard day. What Margaret didn't know, what nobody knew except for an admiral in Norfolk and a SEAL commander lying in a hospital bed, was that the machinery she'd tried to escape had already been set in motion. Somewhere in a classified facility in Virginia, a red folder marked Sanjin Declassification was being processed at 0600 hours the next morning. And 150 military officers were already being notified of a convoy route to a quiet suburban street in Raleigh. Margaret's hands moved through the soapy water, mechanical and without thought. 2 days. 48 hours since security had walked her out with the cardboard box. 48 hours of washing dishes, staring at the same 4 walls, wondering if Emma understood why Mommy's scrubs now sat in the back of the closet like evidence at a crime scene. The water was still warm. She could hear the neighborhood outside, leaf blowers, someone's sprinkler, the ordinary percussion of people living ordinary lives. Emma's voice pierced through it all from the front window, not alarmed, but curious. "Mom, there are trucks outside." Margaret didn't move. Not at first. She set down the plate with deliberate care, dried her hands on the worn kitchen towel with the same precision she'd used preparing for surgery. When she looked out the window, her breath caught for exactly 1 second before her composure settled back like a shield. 8 military vehicles. Not Humvees. Not transport. MH-60M Blackhawks with markings she recognized from another lifetime. The convoy stretched the full length of Magnolia Drive, a quiet suburban street that had never seen anything like this. And standing on the lawn, 150 uniformed military officers forming ranks as if the street itself had transformed into a parade ground. SEALs. Marines. Officers in dress white so crisp they could cut glass. Their presence made the air pressure change. Emma's small hand found Margaret's. "Mom, what is?" The front door opened before Margaret reached it. The Admiral stood at parade rest on her porch, his uniform heavy with the weight of command, his eyes carrying the kind of authority that didn't need to speak louder than a whisper. He was maybe 65, with a scar along his left temple and a voice like a tank idling in a garage. Senior Chief Petty Officer Margaret Walsh. The question hung in the air. Emma turned to look at her mother, and Margaret watched the moment her daughter's face shifted. Not understanding yet. Not quite. But the title, that ancient title spoken in a voice that carried the weight of naval intelligence, it cracked something open in the girl's expression. A pale spreading across her cheeks like she'd just realized she'd been living next to a stranger. "Senior Chief." Emma whispered. A woman in civilian clothes emerged from one of the vehicles, trembling visibly, her badge identifying her as a staff nurse from Oak Creek. Margaret recognized her immediately, the one who'd always said hello in the break room, who'd watched Sterling's humiliation of Margaret with uncomfortable eyes. The nurse held a thick folder marked with a red stripe. Her voice shook as she read aloud. 3 bronze stars. She paused. The officers stood absolutely still. 2 purple hearts. Another pause. Longer. Credited with saving 47 lives under fire in a single engagement. Helmand Province, Sanjin Valley, March 2009. The nurse's hands trembled so badly the folder nearly dropped. The SEAL commander Margaret had saved 2 nights ago stepped forward from the formation, his shoulder still bandaged, his movement careful but ceremonial. He was 28, maybe 29, with eyes that had seen what Margaret had seen. He saluted with the precision of muscle memory stronger than pain. Senior Chief Walsh performed the first successful combat lung surgery in Sanjin while under direct fire. She trained half the medics in this formation. We don't get to walk on our own feet without her hands. His voice didn't crack. It was just fact. The way soldiers stated facts. The Admiral's eyes never left Margaret's face. The Sanjin operation was declassified 23 hours ago. The commander here made it clear that if the Pentagon didn't clear your name, he would burn down the entire building himself. The Admiral's mouth almost moved into something that might have been a smile. We took him seriously. A Mercedes turned onto Magnolia Drive. Everyone heard it before they saw it. The car parked at an angle, rushed, desperate. Dr. Sterling stepped out, and the moment his eyes found the uniformed ranks on Margaret's lawn, the color drained from his face like someone had pulled a plug. His mouth opened. Closed. Opened again without sound. He walked toward the formation like a man walking through water. One of the officers, a master chief with silver on his collar, stepped sideways, blocking his path. Sterling stopped. His eyes found Margaret. Comprehension and horror moved across his features like a wave. "You," he started. Margaret said nothing. Composure. The kind that had carried her through minefields and medical crises and 3 years of his contempt. The security guard who'd escorted Margaret out of Oak Creek Memorial 2 days ago was standing near the Admiral. He held a cardboard box, not Margaret's this time. "Sterling's." The guard's voice was flat, professional, but his eyes were hard as ceramic plating. "I believe you know the way out, sir." Sterling looked at the box. Then at the formation. Then at Margaret, who stood in her jeans and sweatshirt with her daughter's hand in hers, saying absolutely nothing. His hand started to shake. You can't just. I have 30 years. The hospital administrator pulled up behind Sterling's Mercedes. Then an investigator. Then another officer. Then Sterling's colleagues from medical school, their faces showing they'd already been briefed. One by one, his world collapsed in real time. A board member called his cell. Sterling answered on speaker by accident. "Marcus, the hospital attorney just contacted me. If you ever use my name again professionally, I will bury you. Do not contact me." The line went dead. A resident, one who'd laughed at Sterling's jokes about the janitor nurse, turned and walked to the other side of the lawn, creating visible distance. The staff nurse who delivered Margaret's credentials started crying. "I'm so sorry, I didn't know, he made it seem like you were incompetent." Sterling grabbed the cardboard box with shaking hands and walked to his car like a man moving through a dream. He didn't look back. The Mercedes pulled away slowly through the parting ranks of officers. The whole thing had taken 40 minutes. That evening, after the officers had left and the convoy had dispersed, Margaret sat on her porch with Emma's head against her shoulder. Her daughter had stopped asking questions. She'd just watched, learning what it meant when someone's world revealed itself to be different than she'd assumed. Margaret held the combat boots in her lap, the same pair she'd carried home in that cardboard box 2 days ago. They were worn. Scuffed. The leather cracked in places. They smelled like desert dust and memory. "I was a doctor," Margaret said quietly. "Not like Dr. Sterling. A combat medic. And then something happened that couldn't unhappen. So they made me disappear." Emma looked at the boots. At her mother. At the decorations that now sat openly on the shelf beside them, medals that had lived in a vault for 15 years. "You saved people." "Yes." "A lot of people." "Yes." "In Sanjin." "Yes." Margaret pulled her daughter close. "True class is what you do when the lights go out, baby. When nobody's watching and there's no reward coming. That's the only thing that matters. Not the medals. Not the rank. Just whether you showed up and did the thing that was right." The last light of the day caught the medals, and for the first time in 15 years, Margaret Walsh felt fully visible. 6 months later, Margaret walked through the parking lot of Raleigh's largest grocery store in her navy dress uniform. Emma held her hand. Her ribbons caught the afternoon sunlight, gold and purple and bronze, restored and official and undeniable. Near the store entrance, a man sat at a folding table with a banner reading supplemental insurance, affordable rates. His tie was crooked. His eyes were hollow. Dr. Sterling looked up as Margaret approached, his mouth opening as if to speak. Margaret didn't slow. Didn't look directly at him. Just walked past with her daughter matching her stride. Emma glanced back. Once, then whispered, "Mom, wasn't that? Margaret squeezed her hand gently. Just someone who forgot that rank and credentials don't make you worthy. Your actions do. They walked into the store together, the automatic doors sliding open like they'd been expecting them all along. If you're watching this story and you want to know what happens when the system finally sees the truth, subscribe to the channel. Leave a comment. Have you ever been underestimated by someone who didn't know your real value? And hit like if you think Margaret's vindication was worth the wait.